Hello, this is Christopher South, and today we're talking about some of the things that we've been learning in EMP2 when it comes down to blood. And so one of the first things is I want to talk about when you come to the emergency department, we're either going to give you blood or we're going to take blood from you. So the first thing we're going to do is we're actually going to take blood from you. So if you came to the emergency department, depending on what your chief complaint is, the physician may need to have certain studies done in the laboratory to be able to determine what's going on with you. And so in the process of starting an IV for most of us here, we will go ahead and draw what's known as a rainbow. And so there's some of the blood tubes that we have here. And so why is this important? So basically, when a patient comes in, we kind of learn a little bit about what's going on with them based off of the subjective and the objective findings that we do in the assessment. What we can see, what we can hear, what we can feel, what the patient tells us, the vital signs of different things, but a lot of it we can't see. And so what we have to do is we have to draw blood. And so inside of that blood has a lot of chemical components that will tell us a lot about what's going on with that patient. For example, if we have a patient who has an elevated white blood cell count, that can indicate that patient could possibly have an infection. So if we have a patient that has chest pain, they come in and we check their blood, their laboratory studies shows an elevated troponin level, that can indicate that there is damage to their heart. If they have an elevated BNP, for example, that can indicate there is potential for heart failure. So when we're drawing blood, it actually kind of tells us a lot about what's going on in that patient's state. If we have a patient who is maybe short of breath, we can go into their artery and we can draw a blood sample out, and you get something called arterial blood gases, which tells us a lot about the pH and some of the other components of the arterial blood and the gases that are in there to let us know about the patient's respiratory rate. So some of the basic labs that we pull out is what's known as a BMP, which is a basic metabolic panel, which tells us a lot about the basic metabolic functions that are happening in the body, including kidney function, what their glucose level is, and things of that nature. We also look at blood studies as well. We look and see what their platelet count is. We look and see if that patient is potentially anemic, what their red blood cell count is, and things like that. On the other side of the scale, if once we take that patient's blood and we can decide what's going on, depending on what their blood levels are, we may have to give them blood. And a lot of times we give patients blood because maybe they were in a traumatic accident and they've lost blood either internally or externally. And so the only replacement for blood which is lost is blood. So if I put a bunch of crystalloids in there, which are IV fluids, what can happen is it can make that patient much worse, is because that only is a volumizer. It just kind of keeps the space, the vessels filled up with fluid. But if we don't put the right fluid in there, it's just like if you put water inside where the oil goes in your car, yes, it's going to show cool, but it's not the right fluid. And so the fluid of choice when you lose blood is blood. And so the reason for that is because blood contains those wonderful little red blood cells, and they go around and they hang on to oxygen, glucose, and all those things that we need to get moved around, and also takes off carbon dioxide and helps move everything around. So if we don't have those, that patient can deteriorate rather quickly. And we can see patients who maybe are anemic who need blood, patients who maybe suffered from cancer, patients who may have a traumatic injury and different things. So let me tell you, when you come to the emergency department, if you're not getting blood, we're probably going to take it from you. So here's my video for today, and next week we will start a two-part series about some cardiovascular issues. The first video will talk specifically about some EKG changes, and I'm going to show you several different waveforms on the monitor of what's going on in the heart and some of the conduction block delays and different things that are going on. And the week after that, I want to talk very extensively about congestive heart failure. So thanks for watching. I hope you learned a little something about what we do with blood in the emergency department. Take care.